Due to cancer treatment, you can get into menopause early. But what does that mean for your sex life? Hi, I'm Nienke Dekkinga, a Dutch sex educator specialized in cancer-related sexual challenges. And in this video, I'm going to talk about early menopause due to cancer treatment. What are the symptoms? And more importantly, how can you deal with them? Early menopause due to cancer treatment can be a shock and might feel physically and emotionally overwhelming. Sudden menopause can cause more severe symptoms than natural menopause. The symptoms will pass, but it can take a couple of years. There are different reasons why women get into early menopause due to cancer treatment. When your ovaries are taken out, by radiation therapy in your pelvic area, when you have hormone therapy for a hormone-sensitive tumor, and you can also temporarily enter menopause due to chemotherapy. The incidence of temporary not menstruating or early menopause after chemotherapy or radiotherapy varies according to the age of the person, her existing ovarian reserve, type of chemotherapy or radiotherapy, and the total dose of chemotherapy or radiotherapy received. The risk of early menopause increases with age, most likely because older women have decreased ovarian reserve compared to younger women. So there are several reasons to enter early menopause, but not every early menopause is permanent. But what are the consequences of early menopause? Infertility, which for many women is devastating. Due to lowered estrogen levels, hot flushes, mood changes, sleep disturbance, joint aches, but also irritation, itchiness or dryness of the vagina, or poor lubrication during sex. These symptoms may occur even while you're still having menstrual periods. The onset of symptoms may occur gradually or suddenly. And psychological distress with increased rates of anxiety and depressions we also see. And long-term consequences include osteoporosis and cardiovascular disease. But in this video, I focus on vaginal dryness and reduced lubrication during sex. So let's dig deeper into vaginal dryness. This can be quite uncomfortable. Vaginal dryness can make the vagina very itchy or irritable. And you're also more prone to vaginal or bladder infections and pain during sex. The reason for this is atrophy of the vaginal mucosa under the influence of a lowered estrogen level. The mucous membrane becomes not only thinner, but also more vulnerable. And this can cause light blood loss after sex. So, what can you do? Hormone replacement therapy, HRT, helps to relieve symptoms for many women who are able to take it. And HRT means taking a tablet form of female sex hormones to replace the hormones that your body used to produce naturally. HRT is not suitable after some types of cancer, such as breast cancer. Talk to your doctor about whether you can take HRT. Non-hormone treatments may help if you can't take hormone replacement therapy to relieve your symptoms. These include creams and moisturizers that you put into your vagina. A moisturizer is not a lubricant, but can be compared to a day cream that you apply to care for your skin. It's important that it has the same pH value and osmolarity as the vagina. There are many different brands like Replance, Yellow Femme, Primino, Vegicen, and you use them a few times a week. Ask your doctor or nurse about whether you could use a vaginal estrogen if lubricants and moisturizers do not help. This can help to moisturize the vaginal area, but we need more research to find out how safe it is after breast cancer. Recent research has shown that after menopause, women do not become less moist during intercourse, if there is sufficient sexual arousal. Unfortunately, I have not been able to find any studies that have examined this in women after cancer treatment. But I can imagine that this also applies to women after cancer treatment. For good lubrication during sex, the key element is there sufficient sexual arousal? When the normal everyday vaginal lubrication is less due to lowered estrogen levels, it is really essential that there is sufficient sexual arousal. If not, it's more likely that you experience pain and discomfort during intercourse. There is a difference in everyday vaginal dryness and decreased lubrication during sex, so make sure you have enough adequate sexual stimuli. I made a whole video about how does sex work, where I explain more about what you need to get more sexually aroused, and I put a link in the description. When there is sufficiently adequate and effective stimulation, and there is still insufficient moisture, a lubricant can be used. And there is a wide range of lubricants on the market, such as Pure, Silk, Yes, Durex Lube, Aquaglide, and a whole lot more. You can also use a lubricant to get more aroused. Many women find, thanks to the smoothness of lubricants, touch more arousing. I hope you liked this video. If so, click the like button and subscribe to my channel when you want to see more videos. And if you have any questions about this topic or a related topic, drop a comment below and I'll be happy to answer.